Hello, and thank you for joining our discussion today and talking about managing the care of your veterans on a day-to-day basis utilizing Cerner solutions. Now, prior to beginning our discussion and introducing ourselves, we'll first meet the veteran whose story we'll be following today.
Welcome to the Cerner Theater. Join us as we follow Felix on his health journey. Felix is a 65-year-old naval veteran. During his service from 1970 to 1986, Felix was assigned to 5 afloat commands and 3 shore commands, including a position as an instructor at the U.S. Naval Academy. Felix also served a year's tour in South Vietnam during the Vietnam conflict. Since his honorable discharge in 1986, Felix and his wife Arlene have created a beautiful family in his hometown where he took over his father's business. Today, Felix struggles with hypertension, hyperlipidemia, and type 2 diabetes. For the next 60 minutes, we'll explore Cerner solutions that help support quality outcomes and controlled costs. These solutions span the continuum of care, creating a completely integrated electronic health record throughout a lifetime of care.
So that's a little bit about the veteran whose story we'll be following. To introduce ourselves, my name is Jason Tennyson. I'm a registered nurse by background with Cerner. I began my career intraoperatively as a circulator nurse, and from there transitioned over to the critical care setting, caring for patients both in the surgical ICUs as well as cardiovascular ICUs.
And I'm Nathan Kramer, a veteran of 10 years. I served in the United States Army as a combat medic, and in that time I took 2 tours in Iraq and also a tour in Afghanistan. From there, I transitioned into the civilian sector, where I became a nurse locally at Kansas City with their children's emergency room department, and I got to use a lot of the solutions that we are going to present to you today, and I'm very excited to present them to you.
Now, throughout our discussion today, we'll be treating Felix throughout a variety of venues of care throughout the entirety of your enterprise. Now, when we first encounter Felix, we'll do so from the overall population health perspective, so managing that population of veterans as a whole. Next, we'll pick up with Felix from his own perspective as he actively engages in his health care through the comfort of his home via My HealtheVet. Next, we'll see Felix as various members of his patient-aligned care team in the ambulatory clinic setting. We'll talk about referrals and how they move throughout your enterprise. We'll also be seeing and treating Felix in group therapy. Now, fast forwarding in time, unfortunately for Felix, his conditions are going to begin to change a bit. He will present over to the emergency department. He'll be subsequently admitted to the hospital, where we'll see that process full circle through discharge, sending Felix home with the tools that he needs to be successful in his plan of care, as he's going to be followed closely by a care manager post-discharge. And then finally, we'll take a step back, take a look at all of these workflow processes, and talk about utilizing them to drive process improvement throughout the entirety of your enterprise. But as I mentioned, we'll first encounter Felix by taking a step back and talk about managing the overall population of your veterans as a whole.
Now, Felix is just one of the millions of veterans that are going to be coming through your VA facilities. How are your facilities tracking and trending those soldiers? How are they keeping care of their chronic illnesses in the comfort of their home? Cerner takes an approach with their Healthy Intent platform by knowing, managing, and engaging with that patient population. And what I mean by that, this platform is going to take in many different data sources, whether that be legacy data from your Vista instances, or that be that crucial DoD legacy information pulling into here. But it's also going to aggregate that information and then present it to a care manager so that they can manage that care population. An example of this is one of our partners, Children's Hospital of Orange County in LA. They have EPA values being pulled into this Healthy Intent platform. It aggregates that information and then puts it out to those school nurses and those parents that are taking care of those asthmatic patients so that they may increase those asthmatic dosages of medication for those patients at this time. Very exciting when we want to become proactive and increase those detection of PTSD in our veterans at this time. Now we're going to jump over to that care manager and see how this information is aggregated and presented to them. From this dashboard, we can see all that information pushing forward here. And if you remember in the beginning, Felix had hypertension. So let's drill down into that particular area for this care manager. As we do that, you can see Felix rises to the top. His high blood pressure is not being managed very well, but no worries. Not only can we manage it from here, but we can also engage with those veterans right from this screen also. As we outreach to them, we can send messages on how to increase dosages of medications or how to improve nutritional values and intake right from the comfort of their home. Now that we've done a great job managing that, let's jump into that front office staff area and how they're actually going to schedule Felix at this time. As that front office staff logs into their new system, they're going to be presented with a tracking list. This is the list of veterans that are coming in for the day, and we have all the statuses right here updating for us. In fact, we have color coordination assisting those front office staff with telling us what those statuses might be at this time. But let's not forget about Felix. Let's get him scheduled today and see how easy that process actually can happen. As we look up our veteran, we're going to be presented with some basic information. Now, whether this front office staff is taking it via phone call or actually is scheduling it from that My HealtheVet portal, it's easily information that we can enter here. And on the right-hand side of the screen here, you're going to be presented with those general demographics of those veterans. And we could update that information here, whether that be an address or phone number, right from the screen. Not only that, how many times have you or I actually been presented with options for an actual appointment that we wanted at this time? Let's say Felix did want a certain time and his PAC team member was not available. We do also offer an area where we can see every clinician within this charting so that we can get those veterans access to those appointments for them to be seen. Now that we've done a great job taking care of our veteran, getting him scheduled for the day, let's now join Felix as he enters into his home and is going to log into My HealtheVet. Now, as I mentioned before, we're going to be picking up with Felix as he is in the comfort of his home, and he's going to be logging into My HealtheVet. My HealtheVet is going to be that patient portal where Felix is going to manage and know his actual health. In fact, this is going to have just a few nuances that Cerner is going to bring to the table with look and feel, but it's going to provide and empower those veterans in their health. On the right-hand side of the screen, you're going to be able to see any of those recent vital signs or labs that have came in on those veterans. And now Felix is remembering that he came into My HealtheVet to check on his appointment. So as he launches into that area where he's going to visualize that actual appointment here, a point I'd like to make is that we are empowering those veterans also with options here. And in fact, those options could be to reschedule, cancel, or maybe even put that appointment onto a calendar or a personal calendar, Google or Outlook, that they would like to use at this time. One of our partners, the University of Missouri at Columbia, empowered their patient population with this, and they've seen a 40% reduction in no-shows within their clinic. Powerful when you're talking about saving those clinics money and time, and also affording them more time to have more appointments available for their veterans. Now, Felix also can see that he has a clipboard to fill out right from this My HealtheVet. Now, Jason, I don't know about you, but I every time go into the clinic at least 30 to 40 minutes prior to any visit. And that's not just because of my military background. That's because I know I'm going to be presented with a clipboard of paperwork that I'm going to need to fill out. Now, as I fill out that information, the ironic thing is every time I come into that clinic, I'm usually hit up with that same clipboard. No longer is that going to be an issue. Right from here, you're going to have the ability to push forward this information to your veterans so that they can fill that out from the comfort of their home. Not only are they going to be able to fill it out from the comfort of their home, but this is not just an electronic collection of information. It will be presented to those clinicians in the PACT that they will be able to review and see this information right from their workflow.
We've engaged with Felix from that overall population health perspective. We've scheduled an appointment with his patient-aligned care team, and Felix was now able to interact with his care from the comfort of his home. Our next stop will be picking up in Felix's care as those members of the patient-aligned care team as he presents over for his appointment. Now logging into the record as the patient-aligned care team in the clinic setting, you're immediately presented with your organizer view for the day. This view is going to let you know who your veterans are, at what time you'll be seeing them, how long you'll be expected to interact with each veteran, the details surrounding their appointments for today, as well as the status of that appointment. There you can see Felix on the list. His status is indicating that he has been seen by the nurse. The great part about these statuses is that they're updating automatically in the background. So as soon as the nurse documents this intake form on Felix, it's letting the rest of the care team know exactly how Felix's appointment is progressing. Now, the other side of that is by being able to capture this information in real time, we're also able to run throughput reports and use that to drive process improvement throughout your enterprise. So we see Felix on the list. You know he's ready to go since he's been seen by the nurse. Let's go ahead and jump into his record. Always an exciting time in the discussion, the first time that we are in a veteran's chart, so we'll go ahead and orient you to the screen. Up at the top is the blue banner bar. You can see Felix pictured there in the corner of the screen, as well as some basic veteran information. Now you're also going to be presented here with a specific clinic portion of his chart. The medical record is going to recognize who you are, your role, and in which venue of care that you're seeing your veterans. To that end, this information is adapted to what's most appropriate for you to be seeing. So for instance, if you were logged in as a surgeon, you would see things like anesthesia records or electronic surgery request, or cardiologist will have certain labs prioritized floating to the top of that component. It's reducing the amount of time that you're in your veterans chart having to mine for data. Now we can further personalize this information as well. So you know you're getting information adapted to your role, but you can also review that information in the manner of your choosing. For instance, if you wanted to see Felix's vital signs first, every time you jumped into his record, a simple drag and drop or show or hide any of those components is necessary to really make it satisfy your line of thinking. All of these components down the left-hand side of the screen are similar to those components that are plotted out at the bottom of the screen in CPRS today. So as you're working your way and interacting with your veterans' information, you're simply working from top to bottom. At the bottom of the screen, you're pulling all of that information into your thoughts, your findings, your documentation for today. Over on the right-hand side of the screen, note that your documentation components are available. So at the source of information review, you can begin to jot your notes down and to document on Felix without having to leave the screen. Now, starting for the top and beginning to review Felix's information, his chief complaint or his reason for visit, you can see has already been documented by the nurse. It's available for you to review within his record. We can support that hypertension follow-up by reviewing his vital signs, noting his blood pressure is elevated again today, but we can also graph, track, and trend these vital signs out over time. So this is one longitudinal record for Felix. Whether these vitals took place in the clinic, in the ED, or in the inpatient setting, they're available to you to review in this setting. We can further explore any documents in Felix's record from here. We're also able to even have access and insight to the patient entered information that Felix worked on via My HealtheVet. And if you'd like to include any of that information in your documentation today, you can simply highlight it, drag it to the appropriate section of your documentation, and incorporate Felix's own words into your note. Notice that documentation makes its way over. There's an annotation that's generated. When we pull this note together here in just a minute, it'll call your attention to the bottom of the screen where we give credit to the original author and the original source of information. In addition to reviewing documents, there's various scales and assessments that are embedded right here within Felix's record for review, even being able to access that PHQ form from here. So as you're having those conversations with Felix, the conversation starts talking about and addressing Felix's level of depression. Embedded right here within his chart are those detailed depression screening questionnaires and scales. So as Nathan's charting here and filling out all of those forms and questions that you're asking for Felix, those scores are going to be automatically calculated for you there at the bottom of the screen. Now, we do note that that is an elevated depression screening score as we sign off on his information there. Again, the beauty of a longitudinal record is comparing the results that we've just done in that PHQ form to all of his historical assessments. And today we do note an uptick in Felix's depression screening score. In a second here, we'll go ahead and consider a referral out to group therapy. Felix's lab results are also available right here within his record. If any of his labs are standing out, such as his elevated hemoglobin A1C, we can highlight it, tag it, it'll automatically make its way into the appropriate section of your documentation. Felix's home medications are also here and ready for you to review. We can see what he's taking, how many refills he has left on those medications, and even being able to take any action on those medications from here. So if we need to discontinue these meds or file for a renewal on those medications, we can do so right here from within his record. Now that you're actively assessing and having those conversations with Felix, you are ready to begin some documentation. Again, over on the right-hand side of the screen, those documentation components are available at the source of information review. You do have a few options here. You can certainly free text into any of these boxes here, or you can pick up a Dragon mic and dictate into these fields. You've seen tagging already. One last way here is the ability to use tokens and templates to quickly populate information on your veterans. We'll go ahead and leverage one of those tokens to quickly get a history of present illness in on Felix. It's going to automatically capture his age, his gender, his reason for visit today, and then utilizing those blue drop-down boxes to quickly personalize it to fit Felix's clinical picture for today. In a similar concept, we'll move down to the physical exam and utilize one of those same auto text templates to quickly enter those thoughts and findings on Felix. So chances are a veteran that's presenting for a routine hypertension follow-up like Felix is today, 80% of your documentation may look very similar. So let's have that 80% pre-populated, and then utilizing those blue drop-down menus, free texting, adding, or deleting, again, to quickly personalize it to Felix's experience for today. Now, after you've started some documentation, you have a good review of his information, you're now ready to address Felix's problem list. All of his problems are embedded right here within his chart, a very clear, concise, and organized way to approach his problem list. You can see all of his chronic issues, and with one selection, you can make the distinction of the issues that you'll be treating today, such as his hypertension. But we've also assessed Felix's depression's level, so we can also make that, with one selection, make the distinction that, yes, we are addressing his depression this visit as well. If he was one of those, oh, by the way, veterans, we can simply add any additional problems as necessary in fully ICD-10 compliant fashion. Note that we also do support things like HCCs, calculating graph scores, all right here from within Felix's chart. Now, as you're having those conversations with Felix, he does report that he is having some difficulty managing his blood pressure at home. So we're going to go ahead and pick from a quick list of favorites and send Felix home with a blood pressure cuff to better monitor his hypertension. We did mention the uptick in his depression screening score, so we'll also make a referral here for group therapy just to make sure Felix is going to have the help that he needs. All of those orders are going to be routing for signature there at the top of the screen, where we'll be able to assign them to the appropriate diagnosis that we're treating today and sign off those orders, and they'll be distributed appropriately throughout Felix's care team. From there, we can finally review any recommendations right here within Felix's record. So we mentioned in the video that Felix does have a history of diabetes. Well, when was his last eye exam? Or when was his last foot exam? Is he due for his influenza or a pneumococcal vaccine at this time? So all those recommendations, again, being able to ensure that our veterans are maintaining compliance and keeping up with their care. You've worked your way from top to bottom. You have a great historical review on what's happening with Felix. The last step here is to pull all of your thoughts and all of your findings together into your documentation for today. Now, as this note comes together, note that it is populating here in a 2-column format. Over on the left-hand side of the screen, that's all of the work that you've done with Felix today. Over on the right-hand side, that's all of his historical information that's been automatically captured. A couple of things to point out. Those labs that you've tagged have automatically made their way into the appropriate section of your note. Also, the review of systems that you've tagged from Felix's patient entered information. You see the annotation, At the bottom of the screen, there's a footnote giving credit where credit is due. Now, this note is still fully editable from here, so if you need to add, delete, free text, or even utilize one of those auto text templates to quickly get your assessment and plan in for Felix, you're able to quickly do so from here. So with the assessment and plan being completed, one last look at the note, everything looks good. We'll go ahead and get things signed off for today. Now, if you needed to forward this information to anyone else on Felix's care team, here's where you would go to do that. We can pick from a quick list of favorites or have these automatically default as appropriate. However, we'll say the note looks good. Let's go ahead and get things signed off. One last step here in the care of Felix is to make sure that we are going to be coding appropriately for today's visit. And to do that, we'll leverage a computerized assistant coding tool. And that coding tool is going to use a natural language processor. That means whether you've free texted, you've dictated, or used an auto text template, it's going to mine through that documentation and recommend an appropriate visit level charge for today. So let's say that we're feeling great about Felix's visit. We're going to code for a level 5. As that level 5 is selected, it's going to mine through that documentation and see that our documentation only justifies coding for a level 3. We can select View Details to see exactly the additional information that we would need to achieve that level 5 for next time for Felix. So we'll go ahead and stick with the recommended level 3 for today. We'll accept the changes, we'll submit, sign off on the note, and with that, we are truly done with Felix's visit for today. Now, heading back out to your organizer view, note that based on the fact that you have seen Felix here, he is now automatically update it to that seen by physician status. It doesn't quite look like your next patient, Mr. David Broussard, is ready to go. So let's talk about the other aspects of your day-to-day workflow here in the clinic setting. Left-hand side of the screen is your message center, the central hub of communication throughout the entirety of your enterprise. So here's where you'll be getting results to review, any documents that have been forwarded, or any of those general messages concerning your patients. Now, taking a look at those general messages here, we're able to go in and see that you have a communication about one of your veterans, Miss Darla Woods. Selecting into that message, it looks like Miss Darla Woods has had a hemoglobin A1C result come back with an elevated level, and it's letting you know that she's been placed on a diabetic care pathway. Now, hopping into Miss Darla's chart here, we're able to go through and review any of those care pathways that she has been placed on. Now, these care pathways are going to be how we are going to leverage those VA protocols that you're going to be actively using today. So here we can be presented with the relevant documents, the relevant vitals, labs, a streamlined process of reviewing the information about Ms. Darla and her diabetes. Now, note that we also do embed decision trees here that recommend various treatment options. So a streamlined way of reviewing Ms. Darla's information and a streamlined way of getting those interventions out to Ms. Darla's care team as well. Now, where we last left off of the care of our veteran Felix, we have just placed an order for a referral to group therapy. So our next hat we're going to wear is we take the hat of the PAC team off, put on the hat of the referral coordinator, and talk about how those referrals move throughout your enterprise. All of the referrals that we've ordered across your veterans are going to go to one referral work list here. So a referral coordinator can work concentrating just on those group therapy referrals. Now, before we get into Felix's referral here, we're going to just make a few overarching points here. This does comply with the Choice Act. This is a complete closed loop process, both internal and external referrals, meaning that if Felix does not present or misses his next appointment, everyone on his care team is going to have the tools that we need to follow up with his care. It's also going to help reduce delays in care in his referral process and reduce kickbacks. Now, you see that Felix has landed on the referral list. A quick summary view of his case details as well as his veteran information is available from here. If there's anything outstanding here in the referral process, we also have the ability to add any comments, keeping the rest of Felix's care team in the know about how that referral is progressing. Now, in addition to adding any comments, we're also able to support this referral with any documentation, including that PHQ-9 screening tool that we've just filled out in the clinic setting that can be attached right here within the referral. We can also point out any scheduling needs or attach appointments here within the referral process. So if he has an upcoming appointment, we can go ahead and associate this right to this referral. So a closed loop process for managing your referrals, offering a streamlined experience for both the veteran and his care team. So we've placed a referral order to group therapy for Felix. As a referral coordinator, we've routed that order appropriately. The next hat we'll wear here is the hat of the group therapist as Felix presents over for his group therapy appointment. As Felix presents over to his group therapy appointment, our group therapist will have access to every veteran that's attending the group therapy session today. Up in the top and middle of the screen, we see some details surrounding the group. So he's attending his depression and coping group. At the top right-hand side of the screen, we also see some overarching group comments. Now, these group comments are typically repeated and double documented throughout every patient's chart and attendance. Here we only have to chart it once, and that documentation is going to be reflected across every individual veteran that's attending that group therapy session. Speaking of the individual veteran, there you see Felix on the list. You're able to personalize that documentation to his experience. So from here, you're able to write narrative notes on Felix. If you've established any personalized goals for Felix, you're able to document those and reflect your thoughts and findings here. We're also able to chart Felix's general affect quality, his participation level. What was his behavior? What was his mood? Was he a full participant within this therapy session? So having your overarching comments available and then personalizing that documentation to each individual veteran in attendance.
So let's fast forward in time a few weeks. In fact, Felix is back home, but he's just started to develop an illness at this time. His wife, Arlene, has been treating him well. He's started a cough. In fact, he's had difficulty breathing, and a fever has been increasing today. And Arlene has decided to bring him into the emergency department for the VA. Now, we all know here that the emergency department is one of the busiest departments within the facilities of hospitals. How are we managing those departments? How are we getting a good pulse on what's going on within the ED? Cerner is going to provide you with a dashboard here that's going to give you all those metrics to measure and weigh the success of your emergency department. In fact, we can see length of stay of patients right from the screen, and even those department managers can manage those physicians and their door-to-doc times, or how long it's taking for patients to get from the waiting room into an actual room for you. But we all know that physicians and nurses are not the only ones that are holding up care within the ED. On the bottom of the screen, you can see all those ancillary departments and the orders that are generated and they're taken care of at this time. Now that we've got a great pulse on what's going on within our ED, let's log in as that emergency department provider and see our tracking board. As we've logged in now as the physician, you're going to see the tracking board here and all the information that's going on in our ED. Now, I like to draw an imaginary line right down the middle of the screen, and all the information on the left-hand side is patient-centric information. This gives us the names of our patients, the locations that they're actually in, and then the acuity scores of those patients in our department. On the right-hand side, we can see all these icons, and they are representing information and results of our patients. They're also areas we can take action from. This is real-time information pulling in on this tracking list. Now, we all know that throughput, and it is very important to develop relationships with our patients in the ED. So how are we doing that? Cerner is going to provide you with a summary view here that's going to give you the ability to take care of our veterans in a manner before we have even stepped into the rooms. And what I mean by that is, on the left-hand side of the screen, this is all information of previous visits for our veterans, or maybe even visits of current ED visits. We could log right into this documentation right from this screen and research that on our veterans. In the center, we can see any of that triage information from the nurse pulling through, so we know why our veterans are here. We also have vital signs, and as you can see, Felix does have that elevated temperature at this time, so we do know that he is not feeling well. Last but not least, on the right-hand side, you can see that this is medical history or social or family history pulling in, so we get a well-rounded picture of what's going on at that time. Notice at the top of the screen here, those icons that we've seen on the outer tracking board, they're also repeated here. And as you can see, we also have some results coming in on some labs with that green banner bar filling up, knowing that we have information to review. As we've logged in here, you can see that high elevated white count is there. And now as a clinician, we are starting to develop that story. We're starting to develop that actual diagnosis, and we haven't even set into the room. We have an elevated temp. We have an elevated white count. Let's do one more thing and take that diagnostic chest x-ray so that we get a well-rounded picture of what's going on with our veteran at this time. So now that we've ordered that information right from the screen and sent Felix off to the radiology department to receive that x-ray, let's bring it all together with that one last piece of information. And what I mean by that is our outside source of information coming into the system. This is that true interoperability that Cerner is going to provide to the VA. Now, Felix, he is actually a snowbird. He likes to travel down to Florida every year and see his grandchildren down there. In fact, if he's seen in an urgent care or an outside VA facility, how is that information gathered up and presented to your VA clinicians? Now, from here, we can review all that information. It's aggregated and presented in an organized fashion so that we can review this information and then reconcile it and bring it into our veterans' electronic health record if need be. Now that we've gotten a great picture of what's going on with our veteran, we've gathered information, and we notice that Felix is done with that chest x-ray. He's back in the room. Let's jump into his chart right now and review that. Notice it has the same similar look and view that Jason presented to you earlier. Those icons on the left-hand side, it's that same icons, or not icons, the actual components, are the same components that are on the bottom of the screen in CPRS. But Jason reviewed all that information with you already, so let's jump into that diagnostic chest x-ray. Notice he did not log into another system or have to enter in a new user name or password. He can log right into that chest x-ray and review it right from here. We do have some left side consolidation there. So as we've reviewed that with Felix, we can know that he does have community-acquired pneumonia, and it's time to get him admitted into the hospital.
Now that Felix has been seen and treated in the emergency department, we know that he's coming in with community-acquired pneumonia today. Next, we'll switch hats. We'll pick up as the inpatient admitting doctor and pick up in his care from that perspective. Logging into the record to begin the admission process for Felix, you're immediately presented with your list of veterans that you're caring for today. You can see who they are, where they're located, and some details surrounding their experience. We can tell who's the primary contact, as well as any diagnosis that your veterans are presenting with. And over on the right-hand side, we can see any pending labs that are resulted or have yet to be resulted, any of your veterans on isolation precautions or Foley catheters. There's also illness severity components that are available here, adding deeper prioritization into the rounding process. What we see many of our doctors doing is starting by beginning care on their patients that are in the unstable status, moving on to those patients that are discharging, and then picking up in the care of the rest of their patients from there. So adding some deeper meaning and some prioritization in the manner in which you're approaching your rounds. Now, embedded here within your list of veterans is a provider-to-provider handoff known as iPass. This really speaks to the growing partnership that Cerner has with every one of its clients. This iPass tool comes to us from a partnership with Boston Children's. By using iPass, Boston Children's saw a 30% reduction in their communication errors at their source of handoff. So a huge impact in patient care, really at a time when patients can be the most vulnerable. IPASS stands for Illness Severity, Patient Summary, Any Actions, as well as Situational Awareness and Planning. So illness severity, that's the subject of assessment of how your veterans are doing. The patient summary is waiting for you here on Felix, as well as those actions, keeping a closer eye on his trending white blood cell count, and then situational awareness activities, Felix is hard of hearing in his left ear. So now every member of the care team is going to know to adjust appropriately. Similarly to what we've seen in the emergency department, recent clinical data on Felix is going to be available here. So rather than leaving the screen and entering your veteran's chart, you have access to quick summary information letting you know details surrounding their vital signs, any labs, medications, intake and output, and so on from there. We can also see all of the members of Felix's care team, so we can establish clear communication across those care teams. Now that you're caught up in the care of Felix, let's go ahead and jump into his record and begin that top to bottom review here in the admission process. Note here that you are taken to the inpatient component of Felix's record. Again, the medical record knows who you are. It's adapting that information to the venue of care in which you are seeing Felix. Same concept, working your way top to bottom, pulling all of your documentation together into your notes at the bottom of the screen. So talking about admitting your veterans, let's talk about one of the most critical aspects or part of that admission process, which is getting the home or admission medication reconciliation completed. Here we can see all of Felix's home medications. The green check mark is letting you know that the meds history has been completed down in the emergency department. Note that this is the same meds list that we've seen in the clinic, in My HealtheVet, in the emergency department, and here on the inpatient side of things as well. Now, which is great because that longitudinal record is having everyone work off of the exact same medication list. However, if this is the first time Felix has been presenting over to your enterprise, we also partner with SureScripts. That's going to ping out, capture 98% of the pharmacies on the market, giving your clinicians the opportunity to reconcile that information and make it a permanent part of Felix's record today. So now that you know that you're working off of the most up-to-date information, let's go ahead and jump into that admission MedRec process. All of Felix's home medications are available for review here. You simply have the clinical decisions to continue or discontinue as clinically appropriate for Felix. For example, today we'll go ahead and continue all of his home medications. Now note that if something is not formulary for your facility, those therapeutic substitutions are going to automatically happen in the background. As you note, the combo med for lisinopril hydrochlorothiazide has automatically broken down. The Crestor has been therapeutically substituted without a call from pharmacy to doctor or doctor to pharmacist. In addition to addressing Felix's home medications, you also have the opportunity to add any additional admission orders. We know Felix is coming in with community-acquired pneumonia. We do have an order set ready to go for that particular condition. These order sets are going to be a structured and organized way of setting Felix and his care team up for success on the inpatient side of things. Notice it broken up by category here, by admission orders, patient care activities, diet orders, labs, medications, and so on. Some of these orders are pre-checked, some are unselected. You can make those changes as you go, selecting or unselecting, as well as adding any additional orders to this phase of Felix's care. Taking a look at those medications, the levofloxacin that's been pre-selected here has actually been suggested based on Felix's allergies, based on his weight, and various other measurements in the record. Notice that as that levofloxacin is highlighted, you're getting related results over on the left-hand side of the screen. So here's the medication that you're ordering. Here's everything you need to know about it. Things like his white blood cell count, his creatinine level, his temperature. So rather than having to leave the screen to review his information, everything you need is right here at the source of ordering. Now you've worked your way from top to bottom, you're ready to initiate these orders, sign them off, and those orders will be routed appropriately to those various members of Felix's care team. And all along the way, the nurse is going to be able to coordinate the care throughout Felix's entirety of his interdisciplinary care team.
Now, as we take our hat off as the physician and put our hats on as that inpatient nurse, we all know that many steps have to take place before any nurse hits the floor and starts to take care of our patient population. So Cerner is going to provide us with a clinical leader dashboard. This dashboard is going to provide you with real-time information. It's giving you that bird's eye view of all the patients that are on that floor or any floor that you might decide to look at, and you can see any populating information or orders on those patients. Now, when those regulatory bodies come into your facilities and start asking those tough questions about central lines or how many patients do you currently have with Foley catheters, you can now provide easy and concise answers to those queries. As we log into our care compass here, this is the area which in the nurses are going to plan, prioritize, and organize our day. Back in the day, I used to have a tri-folded piece of paper with all this information, and that was always out of date. Now, currently, this is real-time information updating us where our patients are located, who's taking care of those patients at this time, and we can also see those real-time vital signs pulling directly into the chart here so we can make clinical, concise, actionable decisions in any sentinel event that might happen. Last but not least, I love the heat map at the bottom of the screen. This gives us the ebb and flow of our day. So I know at that 1800 hour, I might be busy or I might need to ask that resource nurse to assist me in any of the activities that are going on. Or that 1900 hour, I'll be able to take a break and grab a snack or something of the sorts. Now that we've got a good overview of our command center, let's actually receive report on Felix. At this time, the nurse from the emergency department is calling up and ready to give that handoff. Now, knowing that handoff is the most critical point in a patient's care within the facility, and as you've seen, the physicians have a great tool, we also are going to provide your nurses with a handoff tool. This is where both nurses are going to review the same exact information of the same screen at the same time so that nothing should be missed or mishandled at this time. Now, knowing that handoff is critical, let me give you an example of how that would happen. Felix is a 66-year-old male that has come into the emergency department today because he's been having difficulty breathing and a cough. He's had an increasing fever, and we've drawn some labs on him today, which then proceeded us to do a diagnostic chest x-ray. From that chest x-ray, we've diagnosed him with community-acquired pneumonia, and that is why we are currently sending him to you to receive care in our facility. Now, last but not least is that one piece of vital information that doesn't particularly have to do with anything medically relevant. And what I mean by this, I used to drive home and remember on that drive home, I forgot to tell that offsetting nurse about Felix's wife and the appointment that she wanted to keep with our patient at this time. No longer is that a problem. Right through here in our Actions and Situational Awareness tab, we can collaborate our care throughout our facility, and we can maintain those pieces of information across all areas within that facility so that those messages don't get missed at this time. Now that we've received such a great handoff, we notice that Felix is coming up the elevator. The elevator doors are opening up. The MA is taking him into the room and getting him connected to all the devices within there. But last but not least, you might be asking yourself, what is that orange box around Felix's name? This is another great example of how this is one integrated record. Remember how Jason placed all those orders for our patient at this time? Now we can be alerted to that, and we can review all those orders quickly and effectively right from this screen. Now that we've reviewed all this information, let's dive into that meat and potatoes documentation of our patient. As we jump into that adult admission assessment, this is where those nurses are going to spend 80 to 90% of their time getting that information in our patient's EMR. Now notice we do have those previous vital signs streamlining across the right-hand side of the screen so we can see all that recent information, but there's also those purple numbers there, and that is from coming in from all those devices that MA had connected our newly acquired patient to. Cerner has the ability to connect to over 1,000 different devices within your facility, and that information is going to streamline back into the medical record. Last but not least, we're going to speed up our adult assessment. We're going to pretend that we've completed a lot of these other items, but I want to bring to your attention that Braden assessment, that yellow portion on the screen here. Now, as we dive into chart that Braden assessment, you're going to notice that it is calculating at the same time that we are charting it. The great thing is not only if you have student nurses or nurses that float to that floor, if they do not know what a Braden score is, they can click on that blue text so that there is a concise message being streamlined across your organization on how to properly do that actual procedure or documentation. Now that we've done a great job documenting, let's sign off on this information. As we sign off on this information, you're going to notice a notification has just popped onto the screen. This is a notification based off of the documentation that we've just completed with Felix. Notice that nutrition score is off, so we need to contact a nutritional specialist. But no worries, the system is doing all the heavy lifting for us here. It is alerting that nutritionist, so no longer will I have to go through that Cardex or remember an extension. The system is contacting that nutritional specialist for our veteran at this time. We've done a great job with our assessments. We've done a great job getting Felix comfortable. Let's start the healing process and start to administer some medication. Now, this is the medication administration record. Notice this is all the medication that Felix has received or is going to receive. We have color coordination assisting our nurses on when and how to give that medication. And then we also have some ability to reference any of those medications at this time. Now, we know that the VA does a great job with BCMA scanning, but we do want to show you how easy we're going to do it right from this same screen here. Now, as we scan our patient's wristband and identify that we do have the proper patient and the medications are going to pull up here what we can deliver at this time, we're going to scan that medication that we're going to deliver, and it's going to pop up a screen that's going to give us those last 5 rights on how to give that medication. So it's not just the technology driving care, we still have that clinical decision on what we're doing with our veterans. As we sign off on that medication here, we're going to complete that. And I also would like to point out about our smart pump programming capabilities. Smart pump programming is another additional piece that Cerner is going to provide to your VA facilities. It's going to take that terrible task of pumping or starting to program that pump and transferring information from the computer to that pump. In fact, one of our partners, Oklahoma Heart, has taken that steps from 22 down to these 5 easy steps right that you can see before you. Scanning the patient's wristband, making sure that medication is correct by scanning that. We quickly scan the pump to associate the two, review the information, again, having that clinician make the final decision. And last but not least, we sign and push the sign button on the pump to complete that process. Felix is just on one medication. What about those veterans that are on multiple medications in your ICU? How are you tracking that information and making sure that it effectively and efficiently gets into the medical record? Cerner is also going to give you a Infusion Management solution where all that information is being captured. On the top of the screen, we have our hemodynamics that we can review. And on the bottom of the screen, you're going to notice this is every one of the medications that are currently running on all of those pumps, correlating together and going back into the chart concisely. No longer are you going to have to worry about if those rates and changes are actually making good decisions for our patients. It's all going to be seen and recognizable right from this screen. Now, if you don't like this Excel view, we do have a graphical view available to you and those nurses so that they can review that information the way they prefer. Last but not least, we also have a unit view, which gives us every medication of every patient that is on that floor. So if you're a float nurse and you're assisting those nurses at this time, you can see which patients are having medications get low and when and how you can assist them. Now, what I mean by that, we also have color coordination, the red, yellow, and green, that's communicating with you on the statuses of those meds. But it's not just communicating with the nurses, it's also communicating with that pharmacist. So if that order is still in place, that pharmacist is making sure that medication is prepared and brought to the floor so there are no gaps within that procedure.
Felix has been assessed, treated. He has his medications up and running. At this point in the story, we are going to fast forward in time. It's a day or two later. Felix has responded well to antibiotic therapy. He is ready to go home. Our next perspective will put on the hat of the discharging doctor to send Felix home with the tools that he needs to be successful. Jumping into Felix's record to begin that discharge process, again, you are taking to a very consistent look and feel that we've seen throughout our discussion today. Over on the left-hand side, those components are ready for you to review, and noting that the hard work that the care team has done with Felix already is reflected here. You can see that our nurse has already added the patient education and has arranged a follow-up appointment for Felix as denoted by the green check marks. The red asterisk next to the medication reconciliation is letting you know that the discharge med-rec is still required. So jumping into that discharge to home process here, we're going to see all of Felix's home medications, similar looking view as to the inpatient admission side of things. However, you do have a couple of additional options. Note the middle column here, the ability to establish any new prescriptions going out of the door for Felix. At the bottom right-hand side of the screen, we do have two easy buttons as well. So with one simple selection, we can continue all of Felix's remaining home medications. Note that those medications that have been therapeutically substituted on admission have automatically converted back to their original home medications. Now with the second selection, we can discontinue all active hospital orders on Felix. And just like that, that discharge medication reconciliation process has now been completed. So signing off on those home medications, the last step is to pull all of Felix's information together into his discharge instructions. So this is going to contain a little summary of care for Felix. You can see any of his results, his vitals, his labs going out the door. He'll also have access to his home medications list right here from within his discharge packet. For scrolling down further, we can also access any of Felix's patient information. It's going to be attached right here in his packet. We can certainly sign this off, print Felix a copy for his records at home, but what we can also do, in addition to printing that, is connect this directly into My HealtheVet, so Felix can review that information from the comfort of his home at his leisure, even if he misplaces that paper packet.
We've done such a great job with taking care of Felix within his inpatient stay. We've done great safe practices. The healing process is sped up. We're getting Felix to the comfort of his home, and that's where we're going to pick up as that care manager takes care of him. As that care manager logs in for the day, they're going to be presented with this list of patients. Now, remember in the beginning of the story, Jason had ordered Felix that blood pressure cuff that he could take home and entered values into his My HealtheVet. This is where that care manager will receive that information and join in taking care of Felix right from the comfort of his home. Instead of having him come into the facility for repeated times, now we can reach out to those veterans in the comfort of their home and give them access right there. We also can have those goals that we've set up with Felix as a care manager. We can see any goals that Felix has entered in from My HealtheVet, or goals that that care manager has set, or any of the care team members, whether that be a nurse. The point here is that we're care collaborating on our veterans. Last but not least, we noticed that trend in that blood pressure going up, and how do we reach out to that veteran but going into that video visit? And what I mean by that is we're actually starting to connect with our veterans and giving them access to a portal where they can log in and join each other with that care manager. As you can see here, now our veterans are being connected with our care managers and having that video visit so that they can be doing the healing process right from their homes.
And that's where we will end our story with our veteran Felix today, but our journey doesn't quite end there. Next, we'll swap out our scrubs for suits and pick up as various members of the executive team and use that to drive positive veteran outcomes and improve processes across your enterprise. The first member of the executive team that we'll be focusing on today is that of the Chief Quality Officer, where you'll have an overview of the quality of care that your enterprise is providing. Now, the theme of all of these dashboards here is starting from the 30,000-foot view and drilling directly into those areas of opportunity. So here we'll have the opportunity to review where you're meeting the mark in quality of care, where those variances from the thresholds are. What's great about this those tools, it's not only a streamlined place to review and summarize the information, but it's also the place where you'll be using this tool to submit out to those various regulatory bodies. Next, we'll turn our attention to the CMO or the CMIO. We recognize that this is a large investment and we want everyone to utilize the system to its fullest potential. So here, we're going to have insight into how every clinician is interacting with the system, from nurses to pharmacists to our physicians. We can drill straight down to the users or clinicians that may not be having the greatest experience within the record, calculating things such as mouse miles, average time within the record per veteran seen, how long is it taking to do a chart review, documentation, orders, comparing that to localized and national benchmarks, and drilling down to see exactly where we can improve the experience of every clinician interacting with the record.
Jason has just presented how your executives are going to be utilizing the tools presented to them to see how effectively and efficiently the super users and the end users are using the system. How about a lights on network as soon as you turn the switch on for your new Cerner product to see and create metrics that you would individually like to measure when you're actually effectively using this system? What I mean by that is we're going to create those metrics right from this screen, whether that means average response time to endorse results, any of these metrics that you would like to create, you can do that right from here. Now, I've actually produced some metrics from your actual counterparts, the Department of Defense, and shown you here some of those and how they will look. Percentage of alerts overridden. In fact, those alerts are one of your top priorities, and I've shown you here a measurement of alerts fired and the alert type. We can measure those out. So this is where you and your executive team will decide on how many alerts need to be fired and what they're currently doing for your users. Here's another slide that's going to show you the override rates and the amount that are actually being overridden and if they're actually not being utilized effectively in clinical decisions. Last but not least, let's talk about login times. We know that is a particular hot button within the VA. How are we logging in? How long is it taking to log in? We can, again, create that metric to measure and weigh out and present to that executive team so we have good reporting capabilities throughout this process. This concludes our presentation of our day in the life of Felix. I'd like to thank you all for joining us. Last but not least, I would like to also thank you for partnering with Cerner on this journey. There's 28,000 Cerner associates that are proud to be a part of this and partner with you so that we can improve veteran outcomes for veterans and their families. Thank you.